From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Separation anxiety disorder. Separation anxiety disorder, and there are many important points to make here from my own experiences and also from other people. So it's an interesting disease. So basically you see a child or an adolescent, they will have this distress of separation from home or some major attachment figure like a father or a mother or a grandfather or a grandmother. They will have this anxiety of losing them. Sometimes they have this persistent and excessive worry that some untoward end will happen to those major attachment figures. And they worry about the loss or being kidnapped from these figures. And that's why they show that reluctance to leave these attachment figures. And they will have this fear of separation. And persistently and excessively they are fearful. And they show that anxiety in how they behave. Sometimes they avoid school. Sometimes they avoid friends. So it's a persistent reluctance or refusal to associate with others. Sometimes they get afraid of sleeping. And even if they sleep, they get those nightmares of separation again and again. You see, folks, children are suffering from these problems. I saw so many children with separation anxiety disorder. They complain all these different problems like abdominal pain, vomitings, and all these things because they don't want to go to school. They don't want to go to school because they don't want to miss their mom. Now, separation anxiety disorder, to define it, it should be the onset of age should be more below 18 years. And it should last at least 4 weeks. Okay, these are the two important numbers. Should last at least 4 weeks, and it should happen before the age of 18 years. Then we say separation anxiety disorder. And many of these symptoms, they may happen in different ways. There is no set of symptoms that come in a particular order to define these disease. So these things will vary in patients. Sometimes it's early onset, like before the age of 6, late onset after the age of 6, okay, and before the age of 18. So separation anxiety disorder is an important affliction that is affecting so many children. You see, folks, it's the divorce rate is like 50%. Every one marriage in every 2 marriages is falling apart. And the children are now, they are separated, either from mother or from the father. And they go through these psychological trauma. In fact, last week I was watching CNN, and there was this program, American Al-Qaeda, about a New York teenager who went through a lot of trauma and anxiety when his parents separated in a divorce. And he was attracted to Al-Qaeda and radicalism after that separation. I am mentioning this because the separation anxiety disorder can take people in so many directions with very tragic consequences. Now, you see the child, how is the behavior? Sometimes mothers put their over gratification into the children, and they get that gratification when they see the child is dependent upon them. And sometimes mothers and fathers, they might encourage this behavior in their children. So you need to observe the behavior of both the child and the parent. The clinical findings is the average onset is like 8 to 9 years, and most of them are children, and they will have this fear of separation from the parent, usually the mother, and they fear that some kind of danger will fall upon the mother or that particular attachment figure. They are afraid to go to bed, they are afraid to go to school, they complain of nightmares about separation when they sleep. They exhibit different kinds of somatic symptoms. And they might say abdominal pain, and I saw one patient with sore throat. But the real reason that child is complaining of sore throat was he does not want to go to school. He does not want to go to school because he does not want to miss his mother. So you see, they have somatic complaints, and you should always analyze them. Now, how do you treat them? Psychotherapeutic interventions like family therapy, and sometimes individual psychotherapy for unresolved conflicts, and liaison with the patient's school because patient is missing school. So behavioral techniques most often used are systematic desensitization and exposure, and also operant conditioning and modeling and cognitive behavior therapy. These different therapies, psychological therapies, they help. For example, you take desensitization, just desensitizing the patient against that stimuli. Now, what about the pharmacological treatment, SSRIs, and also mixed norepinephrine and SSRIs, like venlafaxine. So, SSRIs, and you can also use benzodiazepines in these patients, and also tricyclic antidepressants. So, SSRIs, and all of them have shown benefit, like fluoxamine, Paxil, Zoloft, all those things. So SSRIs, they are the first line of medications, and then you can also use tricyclic antidepressants. You can use benzodiazepines like short-term clonazepam, diazepam in these patients, and it helps a lot of patients because these medications help their anxiety. If they complain of palpitations, you can also use beta blockers. So that's about separation anxiety disorder, and please post any important points on our website. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you. Are you preparing for USMLE? Please do not waste thousands of dollars on training courses. Get the books written by Dr. Paul with the student-to-student tips and memory aids. The success will be yours, and you will soon realize your dream of becoming a physician in the United States. If you are preparing for Step 2 clinical skills, study USMLE Smasher, a guide helping thousands of medical students to pass this examination. For more information, visit us at www.drpaul.org.